This presentation is on the female athlete. I had the privilege of giving this to the Orthopaedic Guild in Williamsburg, Virginia, October 1st, 2011. The menu includes starting with the Olympics. Many things happened that were very positive for the females in the 70s. NCAA statistics on participation and injuries, professional sports, musculoskeletal conditions, fat or the female athlete triad, the psychology of the female athlete, and conclusions. Women in sport. Competition for women many years ago was quite interesting. Ancient Egypt and Sparta, before 1500 BC, the belief was that participation in sport enhanced reproductive capabilities. And the sports that women competed in were gymnastics, calisthenics, swimming, and competitive games. However, in the Golden Age of Greece, a little bit later, 776 BC, when the Olympics started, women were banned from competing or observing any Olympic events. The punishment was being thrown off of a cliff. However, in 392 BC, the first female Olympic champion was Kanishka. She was the daughter of the king of Sparta, and she owned the horse that won the 4-horse chariot race. Hence, your trivia answer is Kanishka was the first female Olympic champion in 392 BC. Modern Olympic competition, Baron Pierre de Coubertin, who reigned over the Olympics, called the Olympics an exaltation of male sport and excluded women from modern Olympics because they were not athletes, their bodies were controlled by nerves and muscles, and they would risk children left motherless if they competed. Wonder what would happen with the fathers if they competed and died. Would those children be left fatherless? Not really one of the concerns of Pierre de Coubertin. In the Summer Olympics, if we look at participation from 1896 until 2008, there were 12 males in 1896 and no females. And we have indeed come a long way over the years. In 2008, there were 310 males and 286 females. Big increases in males and females, but certainly more equality with females almost reaching male numbers. If we look at the winter participation, 1924 through 2006, smaller numbers in the Winter Olympics, fewer number of sports, more spread out, need more physicians to cover. But in 1924, 22 males and 2 females, and most recently, numbers of 2006, 122 males and 89 females. Certainly the exaltation of sport for the winter for females is figure skating, and now ice hockey was added in Nagano for women. A lot of famous downhill skiers, both males and females, that we love to watch. Olympians who came back. These are great stories. Wilma Rudolph, she overcame polio to star in track. Amy Van Dyken had severe asthma and came back to star in swimming. Anna Curat had burns over 60% of her body, at which time she miscarried, and she came back from this to compete in track. Wilma Rudolph dominated the 1948 Games, overcoming polio. Amazing stories. The modern Olympics, I remember watching this first marathon that females could compete in, coming into the Los Angeles Coliseum. Joni Benoit won the first gold medal for women competing in the marathon. Mary Lou Retton won gold in gymnastics, and she also captured the hearts of a nation. Great role models and mentors for young females who want to be active as athletes. Great stories. A sad story that we remember if we watch those Olympics were Gabrielle Anderson-Scheiss, who was Swiss, came in to the Coliseum and appeared to be near death. It was not possible for the medical staff to touch her or she would be disqualified, and she was determined to finish. That's a great testament to the human spirit. But she had heat stroke, significant electrolyte imbalance. She did finish the race, but in watching her go around the track, I thought she was going to die. Fortunately, she didn't. She recovered and had no residual mental or physical problems. Females certainly are different than males. This was a Life magazine photographic celebration of the Olympic body. Naked Power and Amazing Grace. Sprinter Gwen Torrance is featured on the cover. Holly McPeak, beach volleyball. Gail Devers, there are certainly differences. If you look at her long nails, maybe that's an advantage in track. Certainly we wouldn't see that in male track athletes. Maybe that helps her get off to a 4-point start instead of 2 in track. Life very tastefully portrayed these Olympic athletes in the nude. Jackie Joyner Kersey, she has competed in basketball, track and field, is a great role model for young people, now has a foundation and travels extensively. Great role model, great athlete. The first modern games were in 1896 in Athens. The only woman participant spent 3 weeks training secretly, and she unofficially ran the 40-kilometer race from Marathon to Athens, for which marathons are named. In 1900, in the Summer Games in Paris, women competed in golf and lawn tennis. Margaret Abbott was the first U.S. female gold medalist participating in golf. Babe Didrikson, what a name, what a competitor. In 1932 at the LA Olympics, competed in 5 different track and field events. She didn't like to be called Mildred, she liked to be called Babe. She went on to win 80 golf tournaments later on. Quotes about Babe Didrikson, and this is true of many other female athletes. Babe breaks records easier than dishes. Anything she doesn't play, yeah, dolls. And Babe was really a great spirit for that long a period of time, a true tomboy, so to speak. She competed in everything. And this quote I love, the best way to athletics is to like them. Athletics are all I care for. I sleep them, talk them, and try to do my very best to do them as they should be done. And that she did. She stuck to it. There are a lot of pressures that we put on these elite athletes. This is Bella Carolla, who really isn't that tall. The gymnasts are just 4'10" or less, so he looks very tall. He's about 5'8". This is Kim Zimiskal, who I had privilege of taking care of when she was in the Barcelona Olympics in 1992, and she was billed as being multiple gold medalist. She didn't do that, but she did medal, helped the team, and she came back to Houston thinking that she was not going to be welcomed with open arms and as a hero. However, they had parades for her, and she was welcomed with open arms. She had bilateral tibial stress fractures through which she competed. And these athletes put a tremendous amount of pressure on themselves, but also the coaches put pressure, the parents put pressure, And the question is, do we push our teenage athletes too hard? And in some situations we might. We need to be aware of their psychologic needs and figure out when it is time for them to rest. And healthcare professionals need to be very aware of these athletes and their psyche. And if they do appear to be having more injuries or not happy, try to protect them from themselves for injury and psychological damage by giving them a break. Unfortunately, it's hard to know when to keep them out of the game and for how long a period out of the game. How about Florence Griffin Joyner? She died on an airplane of what was described as a heart seizure. She competed in Seoul, world record holder in the 100 and 200 meter. This was prior to anabolic steroids, mandatory testing. Nothing accusing her of drugs, but we did not have drug testing when she competed. And all of these athletes shown here, all female, do look a little like steroids could have been in their armamentarium of elite competition. Can of worms. Chinese runners and swimmers in Barcelona had abnormal blood tests, steroids and other ergogenic aids. Females were found guilty in the early 1990s, and they thought they could get away with saying that they were eating certain supplements and that there must have been a fungus in those supplements. However, they were illegal drugs, including anabolic steroids and other performance-enhancing drugs. They were caught and disciplined. Oksana Baul, great figure skater, had some issues when she moved to the States with reckless driving, driving under the influence, and alcohol and drug addiction. The modern Olympic Games in 1998 in Nagano, this was the first time that women's ice hockey was a sport. If you remember, the men's team didn't do very well. They came in and lost games, trashed their rooms, and left early, or maybe were thrown out early. There is a difference of aggressiveness of sport, but women's ice hockey certainly would have to be one of the most aggressive female sports. We won the ice hockey gold medal in 1998, and snowboarding was also added, and we did very well in that sport. This is the women's ice hockey team sporting their gold medals. Be the women. A lot of things happened in the early 90s that were positive for women competing in sports. Title IX, 1972, was passed, which spoke for gender equity in sports at the collegiate level. Roe versus Wade in 1973, a woman's right to abortion. Billie Jean King and Bobby Riggs in 1973. Billie Jean beat Bobby. Great for women's tennis and women in sports. And in 1974, the Little League passed that girls can play Little League baseball. Very important things happened in the early 70s for women in sports, and equality. Little League baseball. This is from the testimony of why Little League did not want girls to participate in sports. They were banned from Little League competition because there were more injuries. Girls had weaker bones. Girls had slower reflexes. Girls were slower in running. Girls had less muscle mass. And I love this one, the risk of injury to the ovaries. I would dare say the male testicles are at higher risk for injury in playing baseball than girls' ovaries. The landmark case, early 1970s, Little League Inc. lost their suit to ban young girls from participation in baseball. The present according to the National Federation of State High School Associations, this was 2008-9, the top 5 sports in males and females are as noted. We don't have a sport with the numbers as football for females, so this is where there is some disparity of the one-to-one competition, including in collegiate sports. But the top 5 for males, 1.1 million participating in football at a high school level, track and field, basketball, baseball, soccer, you can see the numbers there. The females' top 5 is track and field, 457,000, followed by basketball, volleyball, softball, soccer. The spirit squads, which at the high school level, majority are females, number 117, almost 118,000. These spirit squads not only support the teams, they also compete, and we do see significant numbers of injuries and female athlete triad in these spirit squads. These are athletes. We need to keep numbers of epidemiology of what kind of injuries they're having and follow them up to see if they're happy adults or how that level of competition affects them later in life. A lot of cheerleaders I ask in the office 10 years after they're finished competing if they would do it again, and the majority say no. Title IX, federally funded schools do not discriminate on the basis of gender in the provision of any educational activity, including athletics. So this is back to the gender equity. In 1972, Educational Amendment Acts requires high school and colleges that receive federal funds not to discriminate on the basis of gender in the provision of any educational activity, including athletics. Title IX requires proportional opportunities by the number of athletes, not the number of teams. That is, if a school has an enrollment of 60% women, 40% men, the athletic participation by numbers should be the same. Scholarship dollars must be provided to male and female athletes proportional to the number of athletes participating. That is 50-50, then the scholarship dollars must be split 50-50. Presently at the collegiate level, Ncaa Participation, this was from 2007-8 according to the National Collegiate Athletic Association. If we compare males and females, these are Division 1, 2, 3, and the total. On the left includes football, so our total of all the divisions, 240,000 males, 178 females, for a ratio male to female of 1.3. However, if we eliminate football, it becomes 1-to-1. So we have over 60,000 football athletes. Obviously, there's no female comparison sport, but we are at 1-to-1 if we eliminate football. Are there gender differences? Sure, there are gender differences. Females have a greater incidence of the triad, FAT, or the female athlete triad, a greater incidence of musculoskeletal injuries, ACL tears, patellofemoral disorders, stress fractures. They have fewer professional opportunities in sports, in coaching, in administration of athletes. And there also is a difference in aggressiveness of sport and the contact nature of sport. Girls and women have less contact sports and in general are less aggressive. So you can see there are different landing patterns in sports with the figure skaters on the left and the wrestlers on the right, and a different attitude and aggressiveness of ease of landing versus being thrown, contact nature. So definitely differences in sports for females and males. Are female athletes different? No, not in their desire to compete and win, and they should not be different in the way that we healthcare professionals treat them.
I can take the pain and I can take the hurt, because I'm so competitive, and I wouldn't care. I would tear my ACL, just to win a national championship. That's all I want.
So she would tear her ACL just to win a national championship. This very competitive UT basketball athlete will give anything to win a national championship, and that they did, as directed by Pat Head Summit. NCAA injury rate by body part, the most recent one of the injury surveillance system, where 16 sports were surveyed in approximately 20% of all NCAA institutions. These are shown as rates. So this is a rate per 1,000 athletic exposures. And the two discrepancies in the sport of soccer and basketball are with ACL injuries in females. This is the website if you'd like to go to this. Presently, the NCAA is not continuing this with this surveillance system. If we look at concussion rates for basketball and soccer, interestingly, there are more concussions in women in both of these sports and games. So if you look there in the middle, soccer women to men ratio is 1.64 and basketball is 1.54. And much greater injury rates in games than practice for concussion, for ankle injuries, for ACL injuries. So it's the games where we need to be particularly careful in making sure that we have coverage for these athletes. When we look at basketball, these are injury rates for ACLs. Most of these are non-contact. It really isn't divided into contact versus non-contact. So these are all ACL injuries over a 15-year period. The females are on the top in red and the males on the bottom in blue. If you can look where in '89, which is when I started doing some research on elite basketball athletes at the Olympic level, big discrepancy in numbers. Again, these are rates, 0.37 versus 0.05 in '89. And then they became a little closer, and then they went back to be a big difference. So over these 15 years, the average rates men to women ratio is 3.38 greater rate of injury in women compared to men. Even though we started intervention programs, there still is a difference that's significant, almost 3.5 times greater ratio of women tearing their ACL than men at the collegiate level. Soccer is a little bit different. In soccer, we see a overall rate for these 15 years difference of 2.75 ratio women to men injury. You can see how there's some variations per year, but still a significant greater incidence of ACL injuries in women compared to men. At the U.S. Naval Academy, there are relative injury risk rates in comparing women and men, and it's interesting in this study that the highest rate of women injury compared to men was with military training, with running, cutting, going over the walls. So in this study, military training was almost 10 times greater women getting hurt than men. Intramural was 1.40 women greater, and intercollegiate in soccer, basketball, and rugby was almost 4 times greater, with the women having a greater risk ratio of injury. This is specific to the anterior cruciate ligament. In my practice of ACL reconstructions that we do are more likely in females 5 years before the males. So in other words, the 15-year-old female is the highest number of ACL reconstructions that I do. And the males will be a little older. They'll be 20. So females tear their ACLs 5 years earlier in basketball at high school level. The other interesting thing are some studies about soccer athletes, the youth soccer who are less than age 16, who move up to play with the seniors are more likely to be injured than the seniors are. So keep your soccer athletes at their level, don't move them up. And this was specifically for ACL injuries. Certainly there are hormonal changes during the menstrual cycle. There are no studies that document a day of the cycle or part of the cycle where the anterior cruciate ligament is more apt to be injured. Certainly we know that estrogen is a very important hormone. We know this by absence of estrogen postmenopause with its effect on bones, where bones will get weak and osteoporotic. Other factors certainly are involved with osteoporosis, including vitamin D, calcium metabolism. There are hormone receptors on ligaments, such as the anterior cruciate ligament, that have several hormone receptors. But at this point, there is no indication that females should change their participation in practices or games based on their phase of the cycle. Studies that are being done and need to be done in the future must include level of the hormone by saliva, urine, or blood, and not base the athlete's cycle on her history of when she is menstruating. And then followed up with large numbers of injuries and look at not only ACL injuries, but back injuries, ankle injuries, etc. So jury is still out. Don't change female participation based on their cycle day. Certainly there may be some premenstrual aggressive behavior play. Not sure what to do with that. Maybe that's when they win more games. If we look at stress fractures, certainly females who are not menstruating and aren't eating well, a good diet, are more apt to have stress fractures. The critical at-risk stress fracture level is the anterior tibial cortex with the dreaded black line. Typically this is taller individuals with a bowing anteriorly of their tibia. The medial malleolus, tarsal navicular, proximal fifth metatarsal diaphysis, or a Jones fracture. These just don't heal very well and oftentimes will require surgical intervention of intramedullary nailing with the tibia or intramedullary screw with a Jones fracture. The high risk side is the tensile side. As you can see here, the Jones fracture on the left, where the cortex is very, very thick. This is the tensile side of the bone, and you can see that little rat bite or the dreaded black line looks very much like that anterior tibial cortex fracture on the right. And if the femoral neck fracture is on the superior side or the tensile side, that should be something that would be treated aggressively with screw fixation. Make the diagnosis. Tensile side of the bone, don't heal very well, may need to have surgery. The lower risk side are the compression side, so the inferior femoral neck, the fibula on the right, that will go ahead and heal. The second metatarsal on the left, that'll go ahead and heal. So the compression side of bone heals better. With the hip, you do have to make sure there's no displacement. And with all of these athletes, assess them for female athlete triad. A dietitian needs to be involved with their intake, good hormonal history, menses, and follow these individuals psychologically as well. Compression sides will heal. Do need to make sure that the athlete does not have female athlete triad. This is an 18-year-old freshman Division I basketball athlete who had midfoot pain, more on the left than the right. She said she had normal periods. I didn't question her much further, but her definition of normal periods was that she had 2 periods a year. That's when she wasn't playing basketball. The other 10 months when she was very competitive in playing basketball and working out, she had no periods. She thought the problem with her feet was that she had to wear certain shoes based on her college requirements, and she thought that's why her feet started. This is her CT scan on the left, bone scan on the right of her bilateral tarsal navicular stress fractures. You can see the one on the left goes all the way down to the inferior cortex, and this is the one that had to have surgery, internal fixation done. The other one healed non-operatively. It had not gone down to the cortex. This is a typical location of a tarsal navicular stress fracture in the medial aspect. It can be difficult to see on plain films. There are some oblique films that can be done, and this is the internal fixation and local bone graft that was done. So this typically is the lateral aspect. A orientation of the fracture is perpendicular to the long axis of the navicular. Eating disorders, the female athlete triad: osteoporosis, amenorrhea, disordered eating. FAT, F-A-T, female athlete triad. The three related factors, the prevalence is difficult to tell. Still probably underreported. Disordered eating, 15 to 62%. Amenorrhea, 3.4 to 66%. Osteoporosis, really the prevalence is unknown. There's a high recurrence rate in anorexia, 30% relapse rate, and a 10 to 18% mortality rate. And most likely you have seen a female athlete with this triad. Make the diagnosis early. If it can be diagnosed when they're in high school, they may have a chance for a cure. However, the results of relapse are the relapse rate is very, very high. These individuals are highly competitive, want to succeed, but have this disorder, and it is oftentimes life-threatening, certainly life-changing.
Kristy Henrich was a world-class gymnast who developed a serious eating disorder.
As a family, we could see Kristy was slipping, and that there was a lot of problems with her. She was getting very thin, and we'd all sit down at the kitchen table, and we told Kristy, Kristy, you can't do this by yourself. If you could, you would have done it. You need some help, and we never stopped loving her. We never gave up hope. All of us were just devastated because it was like Kristy was drowning and we couldn't pull her out. We were reaching for her, but she couldn't seem to grab our hand. But, what that is that she truly believed that she would not die from this. She'd say, "Mom, I'm not going to die from this."
I usually didn't eat during the day. I would just try to purge, and it worked itself up to approximately 15 times a day. I would try to make myself throw up. And it was almost a day-to-day survival. How do you survive, going to school, training for 8 hours, and being put under the pressures of knowing, I felt like my success was in direct correlation with where my weight was.
Very tragic but true stories. Kristy Heinrich, her family didn't even appreciate how serious her eating disorder was. And when she competed for the Olympic trials, one of the judges said that she was too fat and would never make the Olympic team, and she heard this. So comments like that can be very devastating to these athletes. She was very close to making the Olympic team. So think about female athlete triad in these young individuals. If you suspect it, try to get them some help and intervention. It's a team effort to do this.
One of the most common but least understood problems that young people, especially athletes, face today is that of eating disorders. School athletic programs are a fertile breeding ground for such disorders.
They have puberty changes. They're going through stresses from school. They're trying to get into colleges. They may have some family stresses going on at home, environmental stresses. So I think it's even harder today.
35% of normal dieters will progress to pathological dieting. 42% of 1st to 3rd grade girls want to be thinner. 81% of 10-year-olds are afraid of being fat.
91% of women surveyed on a college campus had attempted to control their weight through dieting.
And in a team situation with coaches and players, they work as a team for the sport. But if all of a sudden one of them says, "Look, let's all lose 10 pounds," and it becomes a competition within the team.
Guess what? I lost another pound today.
Yeah, you've lost a lot. You really look great.
Yeah, but not enough yet.
Why is that?
Coach only has one slot for the 440 on Saturday. That means if I can't beat Julie, I won't get to go.
Don't worry, you still have plenty of time. Do you want to?
It is the coaches, fellow athletes, friends, and family members who must ensure normal behavior patterns. There are physical warning signs of eating disorders, which include depression, sleep disturbances, irritability, loss of concentration, crying.
Through the years, that's gotten a lot better. I think people are starting to understand eating disorders, that it's not just about food, that there's a lot more going on. And I think the biggest thing is to just be educated in the matters of eating disorders.
We did this educational video that is available on DVD, Eating Disorders More Common Than You Think, with high school students being the stars of this. If you're interested in that presentation, a copy of the DVD, contact me. I'm more worried about that individual on the right, who is very thin, than the obese one in the middle and a little less obese on the left. However, our eating problems in our country are forever increasing with obesity, but also appreciate the female athlete triad and the setup for that. Body image is important to all ages. Thin is still in. Young females even do anabolic steroids to look cut. Esquire magazine, because beauty has something to say. Thin is in. We remember Marilyn Monroe. Did you know that she was 5'4" and weighed 140 pounds? She also lifted weights, doing free weights, pumping iron. This is a very good short read that was written by Joan Ryan, who was a reporter with the San Francisco Chronicle. She was doing an article and became so interested in these gymnasts and figure skaters that she wrote a book, Little Girls in Pretty Boxes. And I would suggest that those of you who are interested or have any family members, friends, patients that you're fearful of this, give them this book. And it's The Making and Breaking of Elite Gymnasts and Figure Skaters. Case reports, real cases, real patients, some of who had very bad outcome. But this is something that is stunning and frightening, as John Feinstein writes on this cover. Nike, helping athletes with eating disorders. A woman is often measured by the things she cannot control, measured by the way her body curves or doesn't curve, by where she is flat or straight or round. She's measured by 36, 24, 36, and inches and ages and numbers, by all the outside things that don't even add up to who she is on the inside. And so, if a woman is to be measured, let her be measured by the things she can control, by who she is trying to become. Because as every woman knows, measurements are only statistics, and statistics lie. So this is the Nike Shoe Corporation, who has a presentation, they've developed a presentation on helping athletes with eating disorders. I had the privilege of being one of the team physicians for our U.S. Olympic team in 1992 when the Olympics were in Barcelona. And these are gymnasts. I saw them compete. I helped take care of them, lots of injuries. In Barcelona, they never ate meat. They would eat a lot of yogurt and fruit. But when we got back to the White House, guess they were now not in training, and these gymnasts were eating hamburgers of all things. So I think this is a great thing to be balanced. So when they're not competing, they're back eating as normal teenagers would, whatever that might be. Injury patterns, cheerleading injuries. Who gets hurt? A lot of them get hurt. How badly? The NCAA does not track cheerleading injuries. They are not recognized as athletes. So we do need more studies on injury rates in cheerleaders and the epidemiology of cheerleading injuries. Cheerleading fatalities and catastrophic injuries. Cantu and Mueller have an injury registry that's housed in North Carolina. At the high school level, the incidence was 18 of 39, 46% of the injuries, or correction, of the fatalities and catastrophic injuries were in cheerleaders. At the college level, it was even greater, 16 of 21, 76% were cheerleaders. You'd kind of think it would be greater incidence of football athletes. So during this period of time, from 1982 to 1997, 46% of fatalities and catastrophic injuries at the high school level were cheerleaders, and 76% at the college level were cheerleaders. These are the spill out of these numbers of fatalities and catastrophic injuries, direct and catastrophic on the left, and the indirect ones on the right. So the highest rate of fatalities and catastrophic injuries was cheerleading, followed by gymnastics, track, swimming, basketball. What about women in professional leagues? Basketball had the American Basketball League, the ABL, from 96 to 99. The WNBA started in 1997 to present, 16 teams. Soccer had the Women's United Soccer Association, WUSA, from 2001 to 3. I was privileged to serve as the medical director for this, and really ended up being more of a insurance approval, workman's comp type situation. A lot of articular cartilage injuries in soccer. Sometimes it's hard to know when exactly they occurred. And presently there is a women's professional soccer league, which is 2009 to the present, with varying number of teams. This is the WUSA, consisted of 8 teams. It was great for young athletes to look at Brandi Chastain and Mia Hamm, watch them compete, and watch these young athletes see and meet their mentors. The female soccer athletes were very humble. They enjoyed signing autographs, meeting the crowds afterward, and it was a great 3-year experience for everybody involved. I had the opportunity at the opening game for WUSA in Boston to meet Billie Jean King. I was most impressed with her. If you think about Billie Jean King, she's kind of like Babe Didrikson in that every day that I was 11 years old and I wasn't allowed in the tennis team photo because I wasn't wearing a tennis skirt, I knew I wanted to change the sport. And change the sport she certainly did. Women's professional leagues include golf, women's top-level tours, LPGA. They also have the LPGA of Japan, Ladies European Tour, LPGA of Korea, South Korea, and numerous levels of tennis. Annika's Driving Ambition, greatest female golfer in the history. There also are women's professional leagues in football. Again, in 1999, now there are 15 teams. Different breed of female athlete in these leagues. Dr. Aurelia Nativ and I wrote a textbook on the female athlete that divided competitions of different sports, so you can look at the injuries expected in different sports, and also the unique concerns of the female athlete. So I would encourage you to get this textbook if you would like. It is available. The Psychology and Motivation of the Female Athlete. Dennis Sprague is a clinical psychologist that I worked with, and this chapter in the book really talks about the different ways to motivate and understand psychology of the female. Kathy DeBoer, volleyball coach at the University of Kentucky, understood that there was a difference in motivating the female athlete. So optimizing the performance of team sports for the female athlete. It wasn't by humiliation in front of the team, but more by different techniques of knowing each individual athlete and motivating them to be the best that she could be. Gender propriety is a key issue. This is a women's soccer sexual harassment suit that occurred 10 years ago at the University of North Carolina. So there can be some coaching athlete situations that get exposed. We must understand that there are some of those situations potential and investigate those if there is some concern. The psychology of coaching, we hear the cry, be the man. Sometimes there are humiliation tactics by coaches if they're performing poorly, and that doesn't work very well on the female athlete. Female athlete is very competitive, but methods must be used to motivate and match worldview for her to compete to her highest ability. There's sex differences in upbringing, dolls versus soldiers. The work advancement, men like to win promotions, and sometimes women think about contributing and communicating. Pat Heim of the Heim Group has written several books and is a great motivational speaker. She wrote the book Breaking the Glass Ceiling and talked about how there are not as many stockbrokers on Wall Street who are female than male. And this is, again, another psychologic difference that I think is interesting to read if you're dealing with female athletes. So the males like to act like soldiers. They want to win. They want to be promoted. And sometimes the females are more in a sewing circle and looking at each other in a round circle, trying to communicate and contribute. Sometimes this hurts the female in promotion because they may come up with different ways to do things, several different options, and the male may say, this is the way we're going to do it and it's going to work. So the male may get the promotion because of that difference. Be aware it's not you or your gender. There just are some differences. Rearing children, I think we should have little girls play with balls and dolls. Encourage participation in sports. Winning and losing isn't everything. The rewards are good grades and social behavior for females, and in males it used to be athletics and winning. Now I think this is blending together. Female, many years ago, decades ago, was taught to be feminine and not like a tomboy. And the male was taught to be masculine and not like a tom girl. Again, some blending of all these goals have occurred over the years. So there are only a few females in business in Wall Street, executives, maybe a couple of university-based academic chairs in orthopedics. Our orthopedic profession, now I believe the residence number 7%. When I was doing my residency 30 years ago, it was 2%. More physical therapists and athletic trainers are more equity now, about 50-50. Medical schools are 50% or over that women compared to men. But most of the women are going into primary care specialties. And there are other differences in females participating less in careers compared to the males. This is the Pat Heim books that I would refer you to, Hardball for Women, Smashing Glass Ceiling in the Company of Women. While they're picking on Martha, looks like Martha Stewart came out even stronger after she was picked on. She was convicted of fraud and conspiracy in stock deals. Now she's back healthy, out of her ankle bracelet after serving time. So give little girls dolls and balls if you want them to be competitive athletes. This is a 9th grader who won our small division school cross-country championship for the past 3 years, so in the 6th, 7th, 8th grade, and she's now in the 9th grade. Is that healthy? Maybe she'll burn out. Sometimes we see athletes burn out after 6, 7 years competing at a very high level. The father is telling the little girl basketball player, now get out there, Jennifer, and kill. So aggressiveness does happen in female sports. I also think now with our economic environment, there's a lot more pressure on young athletes to perform well and get scholarships. And that's where sometimes parents lose focus of what injuries are and how much to push these young athletes. We as healthcare providers should be the student-athlete patient advocate and make sure that we keep them out at an appropriate time, give parents specifics about when to go back in the game or into practices, because there's a lot more killing that needs to go on to get college scholarships. You just don't want to have these young athletes play hurt and then not be able to play or be active at all if they have significant injuries. Be the phrase be the man. We hear that all the time, particularly in professional sports, but we also can say be the woman. Robert Browning, a man's reach should exceed his grasp, but also a woman's reach should exceed her grasp. We should encourage participation in athletics, regardless of gender, and reward them with support.
Chastain will take it. She missed a penalty kick against China in the Algonquin Cup, and they lost that game.
What a great moment for girl and women's sports. In Pasadena, at the Rose Bowl, over 100,000 people witnessing the U.S. beat China to win the World Cup. Sometimes there are different behavior patterns in celebration. Brandy pulled her top off very quickly, exposing her sports bra. I don't think there was any industry involved in that. It was just emotional and what she wanted to do. What a great moment for girls in sport, little and older. I wrote a chapter in the Athletic Female in 1993 of problems facing the female athlete. And I really don't think there should be as much problems as encouragement or as understanding that you can compete in athletics in any world, in a world of orthopedic surgery. So catch a rising star, catch it if you can. These lines from a children's song should encourage limitless but achievable goals for youngsters. As a child, I was encouraged to play as hard and run as fast as I could. If I beat the boys, that was okay. I was a swimmer, begged my parents at age 11 to let me swim year-round, and I ended up competing for the next 11 years even into medical school, tried out for the Olympics a couple of times. So there is certainly some fierce competition can be uncovered. In this headline was Fierce GLSA Competition Uncovers Hidden Spark in Mary Lloyd Ireland. I did compete for the U.S. in the World University Games in Moscow. Quite an unbelievable experience to compete for your country. I want to thank you for your attention. As an athlete who happened to be female, I think it has made me more confident in my life goals and able to be a successful orthopedic surgeon. I hope you can use this presentation to motivate your families to encourage females and males to participate in the sports that they love, but make it an encouragement of participation and not necessarily a win or lose at all costs. I'd like to thank the Orthopaedic Guilders for their support and allowing me to present this at the final meeting of the Orthopaedic Guild in Williamsburg, Virginia.